show you what we found is wrong with you. Is that okay? And she goes, yes. I go, great. So right here is the body. And so up here in the skull, what controls the body? And she'll say brain. And I go, exactly. So the brain actually has to communicate to the body in order for the body to actually have function. This connection right here attaches to the cells, attaches to the tissues, it attaches to the muscles, it attaches to the organs. It controls every function in our body. You know, we have these fibers in our gums and in our teeth, and if we're having dental work done and the dentist hits one of these fibers, it hurts like the heck. What is that? And she should say, the nervous system. I go, right. So that's your central nervous system right there. And so that creates function. And if there's nothing impeding the brain's communication to getting to the body or getting to the organs or getting to the muscles or getting to the tissues or getting to the cells, then your body's going to function at 100%. And when it functions at 100%, that's when you have health. And then the body would be in a condition of what we call ease. And I think, Sue, you and I both can agree you're not functioning there in the least bit, are you? And she'll say no, and I'll go, right. So right up here, between the brain and the body, what's happened is you have meningeal compression. And if you have any of those, gosh, I don't know what they call them, like Chinese, I forgot what they're called, but they're like, they're called a Chinese puzzle or a Chinese something. And it's a, you can stick your finger in both ends of it and pull it tight. I hope everybody knows what I'm talking about. And it shows the compression. And you can order them from the Oriental Company, and you can order them online. I think they come in like a bag of, a couple bucks for like a bag of 50 or 100. And if you can do this with your patient right here, when you talk about the meningeal compression, you can go, now let's just play like this is a nerve, and let's pull this tight. Do you feel the compression that's happening? And they go, yes. And then you go, well, that's meningeal compression. And so here's what's occurring. You can feel how the blood flow right there in your fingers is getting cut off. Well, that's the same thing that's happening with the nervous system. So if you have the brain that's now trying to communicate to the body and you have this compression going on, how much of that data is going to be able to get through? And the patient should say, well, probably not all of it or not very much. And I'll go, exactly. So you only have part of the data getting from the brain to the body. And if only part of the data is getting from the brain to the body, do you think your body's functioning? And they'll say, no. And I'll go, exactly. So now you have malfunction. And what research shows is that when there's compression on that nerve, the highest it can function is 40%. So when you're looking at this, let's just take this into response to whatever the patient has going on. Instead of putting body here, you know, whatever their conditions are, I would fill in. I go, body is kind of like a, generic. But let's just look at how this relates to you. So what if this was blood flow? Well, migraine headaches are caused from a regulation of blood flow. So if you have compression, if you have meningeal compression going on from the brain to the body and it's cutting off the blood flow, what's going to happen? What are you going to get? And she should say headaches. And I go, exactly. Now, what if this was, the nerve going down to the muscles of your legs? Do you think it's possible that's what's causing the numbness? So whatever they have, I would just kind of fill in with the body. And so by body, we mean heart, lungs, digestive tract. And I would just fill it into whatever fits for that person. And I'll say, so if it's only functioning at 40%, is your body in a condition at ease? And they'll say no. And I'll go, right. So that's a disease process. And just to let you know, it's very similar to like a person who has heart disease developing. And I'm not telling you you have heart disease, but heart disease develops underneath the patient's awareness until they have a symptom. Meaning that person who all of a sudden has a heart attack, that heart attack didn't start instantaneously. How long did it take for that to develop? And the patient should say years. And I go, exactly. So it took years to develop before that person ever had a symptom. And that's the same situation with your case, Sue, is it took years for your condition to develop before you had your symptoms. And then the key thing, one of the neatest things you could do here is to get the person to name all of their symptoms. And the reason why you want to do that is you want to get them to see, one, how many of them that they have. And then two, you're going to do this next step with them. You know, what all have you done to fix your problem, Sue? And she's going to say, well, I've been taking medication. I'll go, right. So you worked just on the symptom. And she'll go, correct. And so what I do is I cover the symptom up with my hand, and I go, now, when all the drugs wear off, what happens? And she goes, well, the pain comes back. And I go, right. So the body creates this pain down here to tell you something is wrong. So that's your warning signal. So symptoms is your body's way of saying, you know what, Sue? Your body's breaking down and you got to fix it. So if you treat it with just the medication, the body's still malfunctioning, isn't it? Because when the medication wears off, what comes back? She goes, the pain. I go, right. So somewhere along the line, one of these symptoms started first. You treated it with a drug, but because the drug was not the cause of the problem, meaning something you never fixed what was causing it, you just treated the symptom, the body was still malfunctioning. Guess what it did to tell you it was still malfunctioning? And she'd say, create another symptom. And I go, exactly. So here's how you get on your first drug, and now you got symptom number 2. And basically, if I had this with the patient, it'd be whatever their condition was. So if this is fatigue, and up here is, you know, goodness gracious, fibromyalgia, or whatever it is, I'm going to label their symptoms and use their symptoms. So now on the fatigue, you know, you were telling me how tired you are, and now you're drinking twice as much coffee, and you're doing other things to try to handle the fatigue. So, you know, coffee is unfortunately a drug because it has caffeine in it. So now you're on drug 1, you're on drug 2, you're still treating the symptom, the body's still malfunctioning. So if the body's still malfunctioning, what does the body have to do to tell you, to give you another warning signal that it's breaking down? She goes, creates another symptom. And I go, exactly. So can you see in your situation, Sue, what you have done consistently is treat the symptom, which has never fixed your situation. And she should say yes. If she says no or he says no, you're in trouble, and you've got to address and you've got to ask, why not? But I'll just tell you, in the history of doing this over the 8 years, I've never had somebody say no. So basically, your next step at this point with that brain-body diagram is to get the person to see that the first thing that's going to go away is the symptom, and if they quit when they're feeling good, that the problem's going to come back. So I just want to let you know, Sue, basically, if we treat you and the pain disappears, but because it's going to take some time to get the cause of the problem gone, if you quit when the pain is gone and the cause is still in place, what's going to happen? And she should answer, it'll come back. And I go, exactly. So this is going to be worked on backwards. The first thing that we're going to do is we're going to work on the symptoms. You know, if we treated you 20 or 30 or 40 times and we got just the pain away and the disease process and the malfunction and the meningeal compression were still in place, and you quit because you're feeling like you've never felt before or haven't felt in a long time, can you see what's going to happen? She'll go, yeah, it'll all come back. And I go, exactly. So our first goal is to get as much as the symptoms gone as possible. Then we've got to reverse the disease, got to handle the malfunction, and then we got to remove the meningeal compression. And I just want to find out from you, Sue, what's causing all of your symptoms? And at this point, she should be able to say the meningeal compression. I'll go, exactly. So what you would like us to do is to remove that. And she goes, yes. And then I'm going to respond with, I just want to let you know that in our office, what we focus on is the cause of the problem and not the symptoms. Because if I focus on your symptoms, I'll be doing the exact same treatment that you're currently doing that will not get you well. And to me, that's not okay. And so then your next step right there is just to describe the type of treatment that you're going to deliver and what you're going to be doing and how you're going to be doing it. And then once you describe that, then all you have to do is treat her. And then once she's treated, she needs to go back up to the front desk. And when she goes back up to the front desk, you got to make sure that your front desk is trained to the point where when the person comes back up there, that person goes, okay, it's a total of $66 today. Do you want to do that by cash, check, or charge? Notice I didn't say it's $22 today. Do you want to do that by cash, check, or charge? Or do you want to pay one of them, or do you want to pay all three of them? You just simply have the person say it's whatever the total for all three is. It's $66. How do you want to handle doing that? Do you want to do that by cash, check, or charge? And for everybody on the conference call, I missed a step, and I apologize about that. But you've got to get your patient's husband there on day 4. And so after I would handle the brain-body diagram, the next thing I would say to the patient before I went into the description of the patient, or you can do it before the brain-body diagram. It fits really well there, but you just need to do it somewhere on day 2, is I would just say, listen, Sue, what I would like to do is I'd like to save you money. Would that be okay? And she goes, yes. I go, great. So the only way that I know how to save you money is by teaching you to do some home remedies. However, we're going to need to teach somebody to work on you because you can't work on yourself. So what I'd like you to do is bring your husband in with you on Thursday when we go over the exam and the x-ray findings so he can see the problem areas. This way, he'll know where they are so that we can it'll actually qualify both of you to come into our workshop that we teach on Tuesday night. So basically, you can see right there what I'm setting that up for is the workshop on trigger points. You can also, if that's uncomfortable for you or you're not doing the workshop, then you can always use the conversation about getting them there for the finances. However, I'll just tell you that some women think they're independent and they're really not, meaning they think that they're going to be able to afford it or make the decision on by themselves, and then they get down to the finances and they're just like, well, I need to go home and talk to my husband. Well, that's the exact reason why I wanted him here to begin with. However, within our CT patients, what I find to be really true is that because they're so messed up and their husband probably already had so much involvement, it's kind of easy to get the spouse there. You could just simply say to them, listen, you've been to so many different doctors, and what we're going to be going over is nothing that your husband's ever heard or seen before, and it's going to be very important for him to be here. That's one of the reasons why I'd like him here. The second reason why I'd like him here is because, I'd like to save you money. And then you can go right into that script that we just went over is I'd like to teach you how to do some home remedies. However, you can't work on yourself. So what we need to do is teach your husband to work on you, but I want him to know where the problem areas are before he works on you. So bring him in on Thursday, and that way it'll qualify you both to come into our workshop that we are teaching on Tuesday nights. You're not going to be teaching the trigger points on day 4 when he comes in. What you're going to be doing is showing the problem areas. Make sure y'all all understand that. Is what you're going to be doing is showing the problem areas, so that will qualify both of them to come in on the workshop on day 2. And so then basically you can do your brain-body diagram at that point and then explain to them what treatment and what treatment that you're going to deliver and how you're going to deliver and what's going to be done and the responses that you're looking for. That's what you're going to go over at that point. Do the treatment with them, and then schedule them back for the following day. And I know for some of you guys, you're going to be, I know one of the questions might be, so should we charge for day 2, day 3, and day 4? My answer to that is yes. However, if you're getting really successful success rate by not charging, then you could not charge. However, I'll just tell you, it gives it a bigger value when you do charge. So obviously that means you'll have to be billing it appropriately, but you need to make sure that you are doing the charge so that the person has a better value to what it is that you're delivering. So that's basically all there is to day 2. And like I said at the beginning, one of the things that you want to look at is what is the result of your day 2. And so if we go back at this point and we look at, okay, so what are my results? They know that we can help. They know that meningeal compression is the cause of their problem. They know that when their symptoms are treated, that it'll improve or disappear. If they drop out of care when their symptoms are gone, they will still have the underlying cause. And if the underlying cause is still in place, the symptoms will return. And then you